Hi, Missen. Hi, Crosslag. I hope I pronounced that properly. Hi, Tema. Hi, Dr. Mo. Hi, everyone. Hi, Nosbarakat. I hope I pronounced that properly too. Yeah, repping the Dental Student Association. Yes, thank you, Crosslag. Nice to have you here, okay? Just waiting for a few more people. Hi. Thanks for sending your love. Thanks for being here prompt, because we know that people do African time, but we're not working with African time today. We're going to be on time, okay? All right. How's everyone doing today? Hope you guys had an amazing morning as of those of us in Toronto, and hope you had an amazing day. All right, just waiting for a few more people to come on, but we're definitely going to start at 9:30. Oh, hi, Nasbaraka. Nice to know that. So you're also a dental assistant. All right. Nice to know that. You guys are like the backbone of dentistry. Like, I just stopped working as an assistant, so I know how you guys feel. So thanks for being here. Hi, Dawalola. Hi, Sukritid Handa. I'm sorry if I pronounced that wrongly. Okay, but hi. Yeah. All right, Korsak, I got that. Yeah, I will check that once we're done. I will check that once we're done. All right, so it's 9:30, so we're just gonna get started. First of all, let me start by saying hi to everyone. Once again, my name is Dr. Damotadentaltoronto. Thanks for joining us on this live. Hi, Mojisola. Thanks for joining us as well. And I just want to apologize about the error for today. I would never ever. So there's something that goes on in Toronto, right, where we have something called daylight saving, and I don't know. I've been here for like a while, and you would think by now I should have gotten used to it, but no, I don't. And this morning, I woke up, and then my phone updated, but I just saw the time everywhere in the house was like on the wrong time, and I'm like, oh my goodness, there's daylight saving, like the time springs forward today. How did I forget this? I'm so sorry. But anyways, we're here now, and thanks for those that joined earlier than we had initially planned, and those in Toronto, thanks for accommodating the time lag, and then we had to move that to 9:30 as opposed to 9 a.m. Thank you all for accommodating the time changes. We're gonna make sure that today is very action packed, filled with so much information. So basically, I'm gonna have Dr. Fatemeh come in shortly. We're gonna just ask her as many questions as we can. So we're gonna have a Q&A, a question and answer session after she's done talking. So while the live is going on and while she's talking, you can just send in your questions, you can send in your comments. I'm gonna try and see as many questions as possible, and then we'll answer them all at the end. Okay, like not at the end, but like when she's done talking, then we'll attend to all the questions. Okay. Hi, Victor. Hi, Andrea. Hi to everyone. So yeah, so I guess we can just hi everyone. We have more people joining in. Perfect. Hope we're all doing great today. The weather is amazing out here today. Hi. All right, so hi, Asma. I can't pronounce the rest, but I'm going to try Asmao Aminau. Hi. Thank you to everyone. Thank you once again. So like I was saying before, I'm sorry that we had to like change the time. The time impromptu was just an error on my part, and I don't mind acknowledging that. The time sprung forward today, and so that adjusts the time difference between those on the EST time and those on the West African time. And so I just decided to make it 9:30, 2:30 to just accommodate those that are on the EST and those on the West African time as well. Hi, I'm Judy Tally. Hi. All right, so I'm going to bring Dr. Fatemeh on now, and then we can just get started. All right, so you guys need to know that I'm not too techie, so bear with me.
Okay, I think I did the right thing. Let's see. So I just sent Dr. Fatemeh, I just sent you an invite to join.
Hi.
All right, perfect. Hi. You see, we figured it out because you see, one
Tech whiz.
tech whiz. I mean, I know I'm one of the few dentists who's not very IT
No,
IT
none of us
inclined.
are. None of us are.
All right, thanks for joining us on this live.
Of course. Thank you for having me.
Just a brief history into how Dr. Fatemeh and I met. She's just an amazing person. So during one of my um times working as a dental assistant, I met Dr. Fatemeh at one of the dental clinics, and we just clicked. She just told me about how she had her license from outside the country and how she took the equivalency exams. At that time, I don't think she even realized I was a dentist. And as she was saying it, light bulbs were just like popping up on my head, like I'm like, I need to know this person. And let me tell you guys, she's a badass. Okay, do not be fooled by this calm demeanor. Okay, she's a badass.
That's
Her
too
her, sk-
kind.
her her skills are amazing, and I wasn't surprised when she told me that she cleared all the exams in one attempt. Dr. Fatemeh practiced a bit, and then now she opened her own practice called Dakota Dental Clinic.
Yes, my
Also an
baby.
amazing, yeah, that's her baby. And then Dr. Fatemeh, you didn't even tell me she's also like an instructor with University of Toronto.
Yes.
Wow. You like, anyways, I'm gonna let Dr. Fatemeh, give you all her dates. Dr. Fatemeh, you can take over from here, okay?
Thank you. First of all, you calling me, a bad, that is peak life for me. No, but I love our meeting story because I remember telling you, like, I remember you talking to me and you were like, where did you graduate? And I said, I graduated in Iran. And you were like, oh my God. Like, I think it was like you were just waiting to see that one person, who had done it,
Yeah.
Yeah.
Yeah, thanks for that. So, like I said, Dr. Fatemeh cleared all the exams in one attempt. And the reason why that was such an aha moment for me is because for those who are attempting the equivalency exams, that is such a big deal because you have very few people who are able to clear one exam in one attempt, and then you have the second one and the third one. So I'm not trying to scare you, but the exams are like, you need to prepare properly for the exams in order to be able to like pass this exams. It's not about being the best student from your university. The exams are set in such a way that you need to prepare properly and you have to have the right information. I took two of the exams, so I know what I'm talking about. You need to prepare a certain way to be able to like pass those exams, and that's why I decided to bring Dr. Fatemeh in, because who else? She's an expert. I mean, she did it. She's an expert in
You're
that
too
field,
kind.
right?
You're too kind.
Right. So basically, you've been hearing about equivalency exams. If you guys have been following my previous post, I spoke a lot on the equivalency exams. Like we said, NDB, meaning National Dental Examining Board of Canada, has two pathways for you to become licensed in Canada as a foreign trained dentist. We have the direct pathway, which is the equivalency exam. So it's basically three exams: the assessment of fundamental knowledge, the assessment of clinical skills, assessment of fundamental knowledge, and then what's the
Clinical
other one?
judgment.
Clinical judgment. Yeah.
Yeah.
And then we have the other pathway, which is the university exam. So for today, we're going to be talking about the equivalency exams, and I have Dr. Fatemeh here for me, and I'm just going to let you take it up from here, okay?
Sure. I'm going to start by introducing myself a little bit to you guys.
Okay.
So, Damien, I think we met in 2019, was it when we met?
2019, yes.
Yeah.
Yes.
So I started doing the exams in I think well, to be honest, the process of paperwork started in 2016 because the paperwork is just a hassle. So you got to start as soon as you can because there's always going to be like, oh, this is missing, that's missing, that wasn't done right, you have to redo it. So start the paperwork as soon as possible. So I did the first exam in AFK was August 2017. Okay. And just to give you an idea, I'm not trying to, scare anyone, but we were a class of 40 something people when we did AFK, when we were going for the AFK exam in 2017. By the end of it, so once we were done we were doing the boards. So imagine like out of that 40 something people, there were only 4 of us that came through all the way, like what you said,
Wow.
first attempt wise, right?
Yeah.
And it has to do with a lot of things. So it doesn't mean anything. It just means people have different priorities in life, right?
Yeah.
So I did the AFK in August 2017, and then we did the ACJ December 2017,
Okay.
and then we did ACS June 2018.
Okay.
And then we did the boards November 2018 at the same time. So I always recommend everyone to do go through the exams, but also apply to universities. Not like any university. If you don't want to move somewhere, you don't have to apply. But if you think it's a reasonable university, like I applied to U of T, and then I got into U of T. Because so the thing is, you never know, right? What if you don't pass the exams? What if you don't get into university? It's always nice to have a backup, especially if that's your plan. If your plan is, I want to be a dentist here, that's just, give it a shot. And so I got the acceptance to U of T right around the boards, before the boards. So I did the boards. I did the IDAP in U of T, which was like 1 semester. And then I started working. So basically, I was licensed in February 2019. And then the first time I practiced was I actually went to Yellowknife for the summer because I just wanted to get away, and I just wanted to work at the same time. So I went to Yellowknife for the summer 2019, worked there, and I loved it. I loved Yellowknife. I loved the work. So then I decided to drop out of U of T and just work full time. But then it worked out because they called me back and said, like, do you want to be an instructor? Because I'd already done the IDAP, right? Which I love being. So in the time after I'd done ACS, I was also teaching ACS at Golden Target, just because, to be honest, so the dental community, Dammy knows, the dental community in Canada, honestly, is so small. You either actually know the person or you have a mutual friend. That's how small it is. Everybody knows everybody. So I just loved like being around the community. Do you know what I mean?
Yeah.
Like even now when I go to U of T and we have the new IDAP batches, it's almost always that I know like 3 or 4 people there,
Yeah.
Or like they know me through someone or whatever. So it's nice, right? It's nice to, it's, we're all foreigners here. So it's nice to have like a nice community here.
Yeah.
So then I was working, that's when Dammy and I met, which I was working, that was in 2019 when I was working, and then the pandemic happened, and then blah, blah, blah. And then that was fun. And then I started my practice in, basically after construction was done, it was basically summer of 2021. That's when we were seeing patients, and that's what I'm doing now.
Amazing. All right, so let me just go over some things that you mentioned just to like clarify, because some people are not like very familiar with some of the terms. So when Dr. Fatemeh was talking about paperwork, so basically what she was talking about was how I was mentioning in my previous post that you would need to get your documents certified. Now, Dr. Fatemeh is very, very right in saying that it takes a long time. And then now with COVID, it's kind of like even a longer time, just because everything is still like trying to get back into the way it was here in Canada. So Dr. Fatemeh is right. Like, you need to send your documents in as soon as possible. For those of you outside the country, you can start off by setting up your profile. You go on the ndbe website. I have a link on my page already. Just go in, set up your profile, upload the documents that you can upload from whatever country you're in right now. And like I was saying, you need to get your documents notarized by a Canadian notary. And so this is a situation where you have to like connect with people that are in Canada that you might know. Because I know when I started mine, I actually started mine from Nigeria. And then I sent my document over to a friend who helped me to notarize. And then he scanned it back to me. And then I uploaded. So it really takes a long time. So just start as soon as you're sure that you want to, you know, come to Canada and all that, because it really takes a long time. Like Dr. Fatemeh is not joking. It takes a long time.
Yeah.
Okay. And then also Dr. Fatemeh also mentioned the board. So like I also said on my page, whether you take the equivalency pathway or whether you go to school, the both processes start with the AFK exam. So we're going to speak briefly on that. And then both processes start with the AFK and they end with the board. So the boards are basically the licensing, the written of what we call the written examination that everyone takes, whether you were Canadian trained, whether you did the Canadian dental school from 100 level, as we call it, or whether you went for the international dentist program, or whether you did the equivalency exams, everybody writes the boards. So the boards are basically the written OSCE exams, okay? And then we'll speak briefly on that as well if we have time. And then we also talked to, and I'm happy you raised a point where you said it's usually good to do both at the same time, honestly. And Dr. Fatemeh actually gave me that advice, and that was when I actually started as well, because initially at that time I know that I was just pursuing the university process before I met Dr. Fatemeh, and then she gave me the great idea to do both at the same time, because she's right, like you just never know which is going to click. It's
Yeah.
more expensive, yeah, but you're worth the risk. You're worth the investment. Let me just put it that way. Because sometimes, and then I'm not gonna speak too much on it, but with each of the exams, you have a certain number of attempts that you can take, right? And then so you just need to make sure that you're not putting all your eggs in just one basket,
Yeah.
basically. And then she mentioned was it Young Knife? So
Yellowknife.
it's a town. So you know how so Ontario has different provinces, right? So we're in Ontario right now. So Yellowknife is in another province. So don't be alarmed by that term. It's just a town in another province, okay?
It's the capital of the Northwest Territories.
Exactly. All right. And then golden target that Dr. Fatima mentioned is also like, so in for each of the equivalency exams, and I'm going to let Dr. Fatima speak on that. There are institutions or companies here that offer like preparatory materials for each of the exams, and golden target is just one of it. Okay. So before we go any further, I was just going to ask, because I feel this is a very important question. Why did you choose? Because you started with the equivalency exams, right? Why did you choose to start with that first and not just go straight into the university process? Or just why did you choose to start with the equivalency process? Because I feel like a lot of people are kind of torn on
Yeah.
which to go for. Even if you're gonna do both, you know, being human beings, you're probably going to put more effort on the one that you're most interested in. Let's be
Yeah.
quite honest, right? So, what made you decide to choose the equivalency process? Because you also mentioned that you did the international dentist program, and then you just decided to, you know, just go ahead with, you know, just practicing, you know, after you were done with your licensing exams and everything. So, why did you choose the equivalency process for you? What was the advantage? What was the thing
Yeah.
that sold you off on the equivalency pathway?
Yeah. I'll just say like the difference between each, okay? So
Okay.
if you do the direct exam, ultimately it's going to be cheaper, okay?
Yeah.
So
Okay.
the universities here, in Iran when I studied dentistry, I paid $0. It was free. But here in
Mm-hmm.
Canada, you have to pay for universities, and it's not cheap
Yeah.
at all.
Yeah.
But the banks give you loans, right? And it's
Mm-hmm.
something that everyone does. Don't be. Some people get so scared of the number. It's not scary, because if the banks know what they're doing, if they give you this loan, they know you're going to be able to pay it off. And it's the same with everyone. Any dental student here in Canada, anyone studying at university, has the same amount of student debt. Um, so the direct exams are cheaper. Okay, they're faster, because if you pass everything. So back then, I'm not sure how it is right now, but back then you could do ACJ and ACS together, actually, like literally days apart. So
Okay.
that you could basically clear all the exams in like a year and a half. Like it was really,
Mm-hmm.
really fast. So it was faster, it was cheaper. Now, a lot of people, when they go to university, sometimes we see a lot of like IDAP students that are specialists, right? Specialists of pathologists, radiologists, like they haven't been in like a GP practicing general dentistry for a while, right? So they just feel like, you know what, I just need to, you know, refresh my memory. I just need to get used to whatever the maybe the insurance system here or the patient management system, whatever it is. So they kind of feel that need. And which I did as well at some point. But then, like I said, when I was practicing in Yale, I think that just gave me the confidence, right? When I just realized, okay, you know what, it's you know, it's insurance, right? You just think about like how the process works. You just think about, okay, what is patient management, what are all of that, and then I was able to move ahead. Now, why did I go with the direct? So a lot of people, when they come to Canada, they actually plan to go to the States at some point. So you see a lot of students here that are doing. So they might be doing AFK, but they're also doing the American exams. I never planned to go to the States, to be honest. I was always going to stay here. So I started with AFK, and then at the time, you needed AFK to apply to university. So it was like, you need to do this anyway. And so that was it. That was the first step. And then, to be honest, it was pretty quick after AFK. So you do AFK. By the time you get your results, I think it's only 2 months after that you're doing ACJ. So it's kind of like, you know, do this as well. And then that was the process then. So that the process then was ACS, the skills exam, is a very, very expensive exam compared to the other two. So it's like, okay, clear AFK, clear ACJ. When you know you've passed, now do AC instead of like doing ACS first, because I think you had the option to do ACS and then do ACJ. But that's not really, imagine you pass the expensive exam and then you fail ACJ, right? So that's investment down the drain. So for me, and then by the time I was doing, you know, once I did AFK, you know, it was just like that was a trend, and you were following the trend of like now everyone applies to university. So I applied to university, which was, you know, at the time you don't know what to expect, right? I've only done this once. I don't know what's going to happen. You're kind of scared. Well, it's a backup. If anything happens, this might work out, and I'm glad I did it. Yeah.
All right, perfect. Thank you for your response, Dr. Fatemeh. So I know you mentioned that at the time when you were writing yours, you could take the ACG and the ACS, like whatever, like one didn't have to follow the other. But I know as of right now, they've kind of like made an update to that where you have to do the ACJ first before you do the ACS, and you have to pass the ACJ first before you do the ACS. Okay, so just so that, because the thing is, with ndbe, they have like updates like almost like every other month. So and that's why I kept on saying, like, even though I posted the information on the page, you have to also go on the website and follow up on their updates, because they change things, you know, like just like this. So you're always, but the good thing is, once you set up your profile on the website, once there's an update on information, they send you like an email, and then that way you don't miss the information. Okay. And then so that was just the only thing I wanted to just speak briefly on. I guess my next question would be like,
sorry. Can I just confirm what you were just saying? Because I think that's a really important point for everyone. In the exams, you go to these classes, you have your instructors. Nobody is going to do the job for you. It's so crucial that you study that website, that you know exactly what are the steps, what are the rules, what are the criteria. You know, people spend all this money on classes, and at the end, they ask like the simplest questions from their instructors, expecting the instructor to tell them, do you know what I mean? Like, oh, what's the break time in between the exam? What are the criteria? What's this? There's PDFs on the website. There's all the information. There's number of participants. There's pass rates. There's which tasks, for example, people fail in most, which tasks people pass in most. You need to have studied all of this. It's your responsibility, right? It's your life. It's your exam. You can't leave that up to someone else and just be like, oh, someone else told me this or that. Like, you just have to do the work.
That's very, very true, because, and I'm so happy that because I just touched briefly on it, but I'm happy that you brought that up, because it's very true. Because there's just so many things, so many intricacies that come into like passing each of the exams. And then that just brings me to the next question I wanted to ask. Dr. Fatemeh, what we really want to know today is, how did you conquer the equivalency exam? How did you do it? Let's take it maybe one exam at a time. You know, just if you want to go deep into it, you can. If you want to talk lightly on it, you can. But I'll prefer you to go deep into it, because that's why we came.
How much time do we have?
We have an hour for today. Now we started at 9:30, so now it's 9:52.
Yeah. Okay, I'll
And
be quick.
then
I could go on for days about it.
no, please
But
don't be quick. Please just give us all the information. We don't
will
mind. I
do.
don't think people mind. Please just give us
Will do.
all the information. How? Because honestly, this is very important. Because I
Yeah.
know there's a certain amount of time, like certain a limit on the number of attempts you can take each of the exams.
Yeah.
And so it's very important for you to get it right the first time, or I think the second time. You don't want to make it to the third time. If you do great, but you just want to keep it at one attempt or two attempts. So, Dr. Fatemeh, how did you conquer each of the exams?
Yeah. So bottom line is hard work, honestly, just studying and just hard work.
Yeah.
But okay, let's go through one by one. So the paperwork was a process in itself. It's almost like one level to me. I think of that as one level because I had to go back and forth so many times. So for AFK, I joined a class, right? And then we were studying. My paperwork wasn't ready. So the deadline for the AFK, I think the submission or you were signing up for the exam was in late May, and I hadn't been approved yet. So I just, to be honest, I was just, I was working as a teacher then. I was kind of studying, not taking it seriously because I thought I'm not going to make it. There's no way I'm going to make it. And then I think the last day, I'm not even kidding, the last day they sent me an email. I think it was like 15 minutes till the office was closed that your paperwork has been approved. And that was 2.5 months before the exam.
Oh, wow.
So then I immediately signed up and I was like, okay, I've lost months. Most people study for, 5 months, 4 months. I think I'm just going to give general advice. If you're studying by yourself and you want to pass, maybe sometime around maybe 6 months just studying by yourself. So I've seen people study for 9 months or a year. But depending on your studying style, then that's the amount of time you need to spend. If you join a class, just go with the class. So whatever the class is doing is fine. Now, to be honest, I wasn't really following the class because, like I said, I thought I'm not going to make it to this one. It's fine. I'll just listen to the class and I'll do the next one. But then, so it was 2.5 months before the exam. And then, so I quit my job. I was like, oh my God, I'm so behind, right? I'm so behind. And I was studying somewhere between 10 to 15 hours a day. And that was 7 days a week, nonstop. I did not have a life. I did not have a life whatsoever. It was just studying nonstop. And I was terrified of this exam. And, I'm glad that I was because our instructors basically would scare us. They would scare us up like pharmacology questions are going to be like this and anatomy questions are going to be like that. And I'm glad that they scared us because when I opened that booklet in the exam, I was like, oh, okay, this isn't that bad. I was over prepared, right? I still think to this day about all the anatomy that I studied for those like part one questions.
Yeah.
That's basically, it's just, why did I study that much? I don't know. But anyway, I was scared. So I was studying a lot and that exam went really well. And I cleared with 91. I don't know if you guys, thank you. You guys,
okay.
I don't know if you guys get scores nowadays. I think it's just a pass and fail, right?
It's a pass and fail, but if you pass, they release your score to you. So if it's the pass or the fail, they give you a score.
Yeah.
And then you can go brag to the whole world if you want to, but they give you your scores for sure.
Yeah. Okay, that's good. So then, and I was like, oh my God, so even during the exam, because I was so scared of it, I didn't know what to expect. So even during the exam, like, is this a prank show? Like maybe these questions are not supposed to be this easy. Like, I don't know what's going on. But then once the results came back, I'm like, okay, it makes sense, right? Then I was so happy about that, obviously. And then we had, I think once the results were out, we had 2 months until ACJ, maybe 2.5 again. The thing is, once the AFK results came out, you literally had to sign up for ACJ, for a spot for the ACJ exam. And I ended up at Western University just because U of T was like full because they go like this, right?
Yeah.
So literally, let's backtrack. When you are starting the exam, if you join a class, the most important value of joining a class is finding friends and finding a group to study with, like-minded people and people to support you. You will not meet one person that can say that they cleared the exams all by themselves without any friends, without any help. That's completely unrealistic. The reason why I was able to do everything, like literally AFK, we had an amazing study group. ACJ, I had an amazing study group. ACS, I had the best batch in ACS. I was blessed with the best friends and the best people in the ACS process. During boards, we were all helping each other. So you need that group of people. So after AFK, the results in the group chats, everyone was like, results are out, because you had to jump on to just, sign up for ACJ, otherwise you would have missed it. And then I've heard of like people who had to like go to like, I don't know, Newfoundland, or like maybe they found spots in Europe or whatever, which is fun. I mean, you go for the exam and then you go for
because
your
I had
tourist
mine in
after.
Halifax. So I had to choose.
Oh, yeah.
I was like, oh my
Yeah.
God.
But that's fun. Come on, you do the exam and then
It was
it's a
fun.
vacation. Yeah.
Yeah, you would.
Yeah.
Yeah.
So then ACJ, I took another class for ACJ. So the class for ACJ is a bit different. Our batch was, our exam was December 2017. That had a very, very low pass rate, and it was a very, very, very tough exam. There's not much to study with ACJ, to be honest with you. Okay.
Yeah.
It's all about how do you go about doing the exam, the actual exam. Like, it's all about, don't pick too many answers, only pick the ones that you're completely sure of. But don't quote me on this, because I think they've changed the structure a bit now. So just look into the criteria now. But that was really it. There was not much to study. So I was studying maybe 8 hours a day, right? But there was not like, it wasn't like AFK where like I can study forever. And then for the exam, we went for the exam. It was a 2-day exam. Everyone was stressed. Everyone was stressed. That's when you started seeing people, just anxiety, right? Anxiety, and try to manage the anxiety and everything. It was stressful. And once I got out of the exam, and I thought to myself, that's it, I failed. I was 100% sure that I failed. It was such a tough exam. And then what happens is, before the ACJ results are out, you're already in class for ACS. Okay. Yeah. So you're like mid ACS. So that you see how torturous that is, because you're spending all this money, right? And you're already practicing ACS. In the back of your mind, you're like, I don't even know if I cleared ACJ yet, right? Yeah. So we were like mid-class ACS, and we got the results. I could not believe it. Honestly, it felt like a miracle. ACS, I'll tell you this. I joined a course. I booked 2 sessions, so morning and afternoon. So I was working maybe like 10, 12 hours a day, but this is obviously dentist physical work. So it's taxing on the body. And then I only had Sundays off. And that went on for 5 months or 6 months, I think 5 months. That was not a fun time, if I'm being honest with you.
True.
I had no social life. I was not working out. I was not, like, it was just non-stop work. And again, because I was so scared, because you hear all these horror stories, and let's be real, it's expensive. I'm not sitting on a gold mine, right? And all I could think when I was doing ACS is, I better pass this one time, because I mean, I can't afford to do this again. Not just like financially, but also like emotionally, and just I would have to take a break, but then you can't really take a break, because once you take a break, you forget things. So it's better to do it like at the next cycle. ACS was a lot of work. The tips that I have, I'm just going to go through every single one of the exams, just give you tips. For AFK, honestly, have a good study group. That's what saved my life. Be part of a study group of people that you feel like are smart people that ask good questions, because AFK is all about repetition. So you know the material. It's just it's about time. It's about when you see the question, you know the answer, right? And that only comes with repetition. And repetition only comes with, if you're part of a group where everyone's like asking the questions, right? They post the questions in the group, and they're like, what was this? What was that? And then you keep seeing it. So many of the questions in the exam, we were like, oh, we just talked about that. We just talked about that the day before. ACJ, honestly, it was just about technique. So you got to be smart in learning technique, and you got to be smart during the exam. So some of the things that I learned in class during ACJ, when I went to the exam, I realized it doesn't really make sense. It's not really, it sounds a bit off. So I went rogue, and I did whatever I thought was right, and it worked. And ACS, again, you need to put in the work. Like, listen, once I was teaching ACS, we had students, for example, who would, if they're booked for, let's say, a 5-hour time with a chair, and their 5 hours is up, they would just pack up and leave. But there's no one waiting to take over that chair, right? I would never do that. I would be sitting there until I had to get up, or they wouldn't come to class on like Saturdays and Sundays. No, what do you mean? It's not a job. It's for you. You need to work. Like, it's just it's about repetition. That's all it is. How many times are you going to do this prep? How many times are you going to do this filling until you get a hang of it, right? So you really need to like work really, 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 really hard if you don't want to go through the process over and over again. And like I said, honestly, ACS, I can just think of so many people, like my friends, we all helped each other with everything. My friends would come over like, I just got this new instrument, try it out. Or I just found this new material, try it out. Or I just learned this new technique, let me show you. And that's what we were doing all the time. all the class, and it really, really, really helped. And then for the boards, then when we passed, then when the ACS results came out, honestly, I was so happy because you always think the worst, right? You always think of like, oh my God, did I do this? Did I do that? Did I clean this up? Did I? And then once the results were out, I was like, honestly, I was so happy. I was so relieved. And then for the boards, I took a class again for the boards. The boards are pretty chill, to be honest, just because of the high pass rate. But I'll be real, no one studies properly for the boards. Everyone's just basically in celebration mode at that time. And everyone's like, oh yeah, it should be fine. It's just like AFK, it's just like AC. And then when you go to the exam, everyone's like, I haven't studied. And you're like, I haven't studied either. And then when I got out of the exam, I was sure I was going to fail. I'm like, oh my God, what did I do?
Oh my
and
goodness.
also because it's a little different. So let's say you look for a specific answer and it's not there, and it's different answers that you need to pick between. So it's not as straightforward. But before the boards that I had my U of T interview and everything. That was pretty exciting. And then I just decided, I asked them, basically I was just thinking about like what to do, and I decided, you know what, let me do the boards, let me get my license. I'll go to U of T because I was so curious to just know what is it like to study in U of T, you know, what is dental school like in Canada. And like I feel so blessed that I got in. And then I just love going back now. It's just an amazing community, right? So that was it.
All right, perfect. Thank you very much, Dr. Fatemeh. Thanks for all the information and all the details. Just to like recap on some things, just because I know that some people who are on this live might not necessarily be following me. So I'm hoping that changes by the end of this live, okay? So ASK, Dr. Fatemeh kept on saying ASK, ACS, ACJ. So ASK simply means Assessment of Fundamental Knowledge, okay? So it's the first exam for the equivalency pathway. So once you're done getting your documents like certified and all that jazz, the next thing you need to do is to apply for the exams. So the first exam is the AFK, which is the Assessment of Fundamental Knowledge. And the next exam is the Assessment of Clinical Judgment, and then which is the ACJ. And then the next one is the ACS, which is the Assessment of Clinical Skills. And by the way, there's another exam that is coming to take over that one. I think it's called the ndbe or something, but it's on my page. And hopefully that is going to give a better pass rate compared to the ACS. Let's see. I think it's going to take over from the summer of this year. I have the specific information on my page, so you need to check the post. But I just wanted to clarify that because we're going to be using those terms AFK, ACJ, ACS because no one wants to pronounce the full name. Okay, it's just so long. Okay, and then also there was another thing that Dr. Fatemeh mentioned, which is very, very important. I mean, like I have the same experience. It's so funny because for the AFK class, we didn't go to the same preparatory classes, but they all have the same thing in common. They make sure that you're very over prepared. And I think that's very important because, I mean, again, you have the choice of like studying by yourself. I mean, if you feel like you are that disciplined, if you have the right materials, then you can do that. And like Dr. Fatemeh said, if you're going to study by yourself, then you should need to give yourself a timeline of maybe 6 months to a year. Again, it depends on what your personal skills are or how well you study within a short period of time. Okay. But for the AFK exams, it doesn't have a very good pass rate, and it's because the exams are worded in such a way that you just have to have the right materials to study with, right? And so if you're going to study by yourself, it's very important that you get the right materials, right? Even though it's an exam on basic sciences, you still have to have the right materials to study. And so in the prep classes, they give you the right material, right? And then they over prepare you. I know for me, the AFK preparatory classes were so stressful. I used to come from Ajax. So Ajax is another town. It's like going from, I don't know, we're all in different countries, so let me forget about using a city, but it was a very stressful time for me because I knew that I needed the preparatory classes because I was new to Canada. I didn't have the right materials. I didn't have the tools that I needed to study properly for this exam. I didn't even know what the exams were really about. Even though on the website they give you some practice questions, and then that also kind of guides you as to how the questions are. But I elected to have a preparatory class, and I'm happy they over prepared me. I'm very happy. So they also like instill this fear. I don't know if they all have this meeting and decide that, what, we're gonna put the fear of God
Yeah.
in these people. I don't know, but they because honestly, when I was going for my exam, I was so scared. Like I was tensed up. And when I got there, I was like, this exam is not that bad. Like,
Yeah.
but I could say that because I was over prepared, you know. So I'm just stressing that point. Like, don't just get relaxed and say, okay, you know what, I'm done studying anatomy and I'm good to go. Like, you need to study everything, anatomy, oral part, like everything, okay? And then also the other thing I wanted to say was Dr. Fatima mentioned a point. She said immediately the AFK results were out, she needed to like rush and then make sure she registered for the ACJ immediately. Now, until you're in the process, you wouldn't really understand what she was really trying to say. So the thing is, for each of the exams, even though they're sit in the whole of Canada, and there's some other countries like Australia and all that. I mean, I don't want to leave Canada to go to Australia to write my exam, and you probably don't want to leave wherever you are to go to another country or whatever. But you have to make sure that you register for the exams in the selected countries. Now, in each of those countries, there are a certain number of states. Okay. And so because there are a lot, you never realize how many dentists, how many foreign trained dentists are in whatever country and are trying to come to Canada, until you actually go on the website and try to register and see that there are no seats available anymore. That's how fast those seats go. And so they also open up I don't know why they do this. They always also open up the registration for the exams in such a way that you might not even really know that the registration is open. So
Yeah.
it's such a very funny process where you literally have to be stalking the ndbe website to make sure that you're able to get a seat. I tell you,
That's when the friend groups come in, because everyone lets you know.
exactly. So I understand what she was saying in saying that she needed to make sure that she registered immediately, because sometimes you might not even know when the registrations are open for those exams, and there's a certain number of seats, so it's not like unlimited. Okay, even though it's supposed to be like a prometric center, but you have to go into a center to actually write those exams. So it's not unlimited number of states. So as you're taking each of those exams, you also have to like be aware of that fact as well. Because I personally ended up I wrote my AFK in Toronto, which is where I live, but I had to go to Halifax to take my ACJ because there were no seats in Toronto under a minute, or okay, well, 5 minutes of the registration opening. So you just have to be aware of that, because sometimes when that happens where you can't actually register, you are then forced to wait for the next session. And then it's such that each of the exams, I know of the AFK and the ACJ, they come up only twice in the year. So they come up, I know AFK comes up, I think February, August. I'm not really sure about the one for ACJ. You have to go on the website, but they come up only twice. So imagine you being prepared, for example, imagine you being prepared to take the AFK in February, and then you don't get a seat and you don't want to go outside Canada, for example, if you live in Canada, and then you're forced to wait till like August. Things like that could just set you back in so many ways. So you have to be aware of that. And then there was also something else that she mentioned, joining a preparatory class. So I want to also raise a question on that, but we're going to take it after we're done talking. But again, it's up to you if you want to join the class. If you feel like if you're confident in your abilities to prepare for the exam. I know a person that actually prepared for the exam, even though he prepared for the AFK exam by himself, even though he prepared for like the year. I don't
Yeah.
think I have that time to put into preparing. I don't know if I'm that disciplined personally, but people have done it and they can do it. So it's your prerogative. Like, if you want to go for a class, you can go. If you don't want to, you can study by yourself. Okay, just make sure you have the right materials. And then I'm very happy that Dr. Fatemeh mentioned how you need like a community of people. And that's kind of the point of this page. You need people, you need a study group, you need a support group, you need people to give you information, you need people to give you information is power. Like, you can never ever underestimate the power of information. So that's one of the benefits of going for a preparatory course or preparatory class. And then I also wanted to mention that with the ACJ exams, one thing that was one thing I need to let you guys know is, so it's a test of your clinical judgment. You also have to answer questions on X-rays. Now, if you're from Africa, where I am from, Nigeria, the X-rays are such that it's like a film, and you just put it up in the air, and then you have to like look through the reflection to be able to see the gray areas separate from the black areas on a dental X-ray. Now, for the ACJ exams, you're viewing your X-rays on a screen, on a computer screen. That could distort your that could destabilize you a bit if you're not already prepared for that. Now, the reason why I was prepared for that was because I worked as a dental assistant, and so I was able to see X-rays on a computer, like digital X-rays on a computer screen, like 24/7. So if you're planning to study for the ACJ by yourself, that's one thing you need to be aware of, right? The X-rays are digital. It's not the one that you might be, familiar with, right? And then also, yeah, those were just the only things I wanted to touch on. And then, you mentioned also like going for preparatory classes. I guess one thing that a lot of people want to also know is funding, like funding for the equivalency exams. I mean, for the university pathway, you have the banks there that are able to like, just write checks for you and all that, because they know that you're going to pay the money back. But for the equivalency exams, how were you able to like pay for your exams? How were you able to pay for the classes that you went for example? Because those classes are not free. They're as expensive as the exams sometimes. So how were you able to pay for everything? Even like, for example, the ACS, you have to buy materials, you have to buy teeth to work on, you have to buy a mannequin, instruments. How were you able to fund the entire process?
Yeah, so it is an expensive. I wish the banks would write checks. They don't really write checks, but yeah, the exams are expensive. They're very expensive, and I think each year they get more expensive, to be honest with you.
I don't know. That's so annoying. I don't know why they do
it's
that.
inflation. I guess it's inflation. It's cost of material and everything. I know people who, if they work and they save up, they have all my respect. It's difficult. I was working as a teacher trying to save up. It doesn't, to be honest with you, when you think of the cost of the exams and you think of the cost of living, because here's the thing, some people work while they're doing the exams. I'm not saying you're not going to pass, but it really reduces your chances. It really does. It really, really does. Especially, like, let's say for ACS, I don't think you can work and do ACS. I don't think that's possible. I don't think you should even attempt it, because what's at risk is so significant that you shouldn't even try. For AFK, like I said, I was still working kind of when I was studying, but then I had to take time off. For ACJ, I had time off. So you have to have some kind of funding. Friends, family, you need to get some credit cards. It used to be, I think there used to be funding, and then they stopped. And then, so the unfortunate thing is, if you're just trying to become a dentist in Canada, you're an international dentist, the banks here, they don't really recognize you as a dentist. So once you become a dentist, they're very generous with you, but not before that. So, but there's Prep Doctors had an interview about funding for the exams. If you just Google Prep Doctors funding, something like that, they have a whole page with the interviews that they did in details. That's probably the only thing, or the closest thing that I've ever seen recently, to be honest with you. Like I said, I've heard stories in the past where banks would give loans or whatnot, but they kind of stopped. So you have to have either money saved up, or you have to borrow from family, friends. You have to have credit cards that you can max out, or and that's it really. Because working while studying or working while doing the exams is not the best idea. That's my opinion. A lot of people also have the situation where they have their spouse working, they do the exams. If they're both dentists, one does the exams, the other one works, and then the other one does the exam while the other one works, That's also an option.
All right. That I'm happy that you mentioned that, because I know quite a lot of people do that. So I mean, you just have to pick what works for you. I know a dentist who, well, she's now a dentist, but she really prevents the exams. She would come from the UK. So she was working as a dentist in the UK, and then she would fly in, write her exams,
for the exams,
fly back out,
That's smart.
So
That's really smart.
that's what worked for her. So she stayed in the country where she could work as a dentist, and then she would pay for the exams.
Yeah.
Right. And so you just have to pick what works for you. As I know, when I was taking the equivalency exams, like Dr. Fatemeh said, there was funding from like banks. There are also like some private loan lenders that I also spoke to, and they were able to give me like a loan. Um, you know, Again, you coming in new to Canada, I don't know if the idea of taking a loan is is not so scary, but at that time it was such a scary option for me. But I just knew that that was the only option that I had. So I would say explore other options of seeing how you can fund the exams by yourself, and then if you don't have any other option, then you can take a loan. Like Dr. Fatima said, I know that as when I was taking mine as well, there was a bank that actually had a program set for foreign trained dentists, and they will give you a loan,
Which bank was
to,
that?
I think it
CIBC?
was, yes, CIBC.
Mm-hmm.
Yeah, they will give you a loan to actually fund your whole process. But the tricky thing about taking a loan is, again, because the equivalency exam just has a limited number of attempts. What then happens, God forbid, if you don't pass the exams, right? So you just have to like figure out what works for you, because whether you pass the exams or not, they are going to expect you to pay your loan back, right?
Yeah.
So you just have to pick what works for you. You can be flying back and forth from your primary location to come into Canada or Australia, or wherever you want to write the exams, and then fly back. Or you can come in, work a bit, save up some money, and then just plan to take the equivalency exams much later, like after you saved up some money. And then if you're lucky enough to have like your spouse coming with you, you can have your spouse working with you. You can have your spouse working while you're taking the exams. People have explored many options, right? But again, even though it's the cheapest route, it's also still somewhat expensive, because we're all coming from countries that the currency is probably not up par with the Canadian dollar. And so it's still somewhat expensive. So I
Yeah.
just wanted to be clear on that. And then also there was something else
Sorry.
wanted.
Can I go over what you just said? So a lot
Yeah.
of people do that. A lot of people do that where they work in their home countries and they come here. I think it's a
Yeah.
good idea for like an AFK, ACJ, because now all the
Okay.
courses are online. They're offering so many
Yeah.
online courses.
Yeah.
For ACS, you need to be here. Okay.
Yeah. Okay.
And the loan that you mentioned. So if you believe in yourself, as a dentist, those loans are not going to be scary at some point.
Okay.
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 They're scary when you take them. They're not going to be scary. You're eventually going to be able to pay them off.
Yeah.
Saving up for the exams is if you can do it, I have all of my respect, but it's tricky, right? It's
Yeah.
because
Okay.
for most people, it's not just the cost of exams, right? It's life
Okay.
expenses too. So you got to be
Okay.
able to pay rent and pay
Okay.
for food or whatever, and then pay for these exams too.
True.
So you're right. So it's different for each case. You might be staying with family. I was staying with family.
Yeah.
You might be living on your own. You might be
Yeah.
having to take out a loan just to pay for rent, right? So it's all the things that you have to take into consideration.
Yeah. That is very true. There's so many factors. You're right. I didn't even think about that, because you also have to think about living expenses as well.
Yeah.
So I guess the take home from this is, even though it's the least expensive part way, you have to realize that to some extent it's still very expensive, because
Yeah.
when you add on the living expenses, all those numbers begin to like add up. Okay, so just plan ahead for that. But it's doable, because many people have gone ahead and done it. When you're done with all the exams, you come out like you just came from like a war zone. You come out so stressed, but you did it, and people have done it, and you'll be fine. Okay. And then I guess the other thing I wanted to talk about was, one very important thing that I don't think we have mentioned is the questions itself. So a lot of you might not be familiar with the term negative marking. So I know back home, when I went to dental school, we coined a term, negative marking, meaning you lose a mark for every wrong question, that you miss. Is that correct? Yeah.
Yep.
So it's the same way with the AFK exams and the ACJ, right? Where if you don't get a question right, you get a mark subjected from your total score. Now, I don't know if every country does that, but I know for Canada, they do that for the ACJ exams, for the AFK exams for sure, and I think the ACJ exams, if I'm
They
not
do that for
forgetting.
AFK?
Yeah, they did that for AFK. Yeah, they did that for AFK. So such that, well, that's what we were told, that for the AFK exams, you need to be sure about your answers.
Mm-hmm.
before you actually put an answer in there, that because you get like a score. And I remember when we used to do questions in classes, they used to mark us down as well for the questions that we missed. Like basically, for example, if you have 10 questions, let me break it down. If you have 10 questions, and then say maybe you get 5 questions right, and then so that's 5 or 10, right? And then you miss 5 questions. So they take out 5 from your total score. So basically, at the end of the day, your scores are 0/10. If you
Okay, I
understand what
see.
I'm saying,
Yeah, yeah,
right?
yeah, I see.
So I know that for the ACJ for sure, because you're testing your clinical judgment. Let me sit and think about AFK. AFK also, I suspect, because I know that when we're in class, they used to do the same thing for us and say like, oh, like
They might have been during the whole curve thing, like curving up and down. It wasn't like that during our time. It was just, 0 or mark. But ACJ, yeah, ACJ, if you pick
ACJ
the
for
wrong
sure.
answer, yeah, if you
Yeah.
pick the wrong answer, it's going to mess up. So you pick, like, let's say you have 10 options in one question, right? This patient
Yeah.
comes in, these are the symptoms. What do you suspect? 10 options. If you
Mm-hmm.
pick like 2 that are correct and the third one is incorrect, that's it, you lose the question, depending on score. But that's the tricky part with ACJ, is
Yeah.
that you got to be able to like bet your life on the answer that you're about to put down. Otherwise, just
Yeah.
don't write it. Yeah.
Yeah. Actually, you're right. Now that you're saying it, actually, I was wrong. It's the ACJ, because you're right. For the AFK, they used to do the curve thing. Yeah,
Yeah.
you're right. For the AFK, so this is what they do for the AFK. So they judge your scores based off on every other person's performance, basically, right? That's a very tricky thing. Even explaining to you might confuse you, but basically, what I'm trying to say is for each of your questions, for each of the exams, be sure of your answers, and that's why you need to over prepare. Okay, and for the ACJ, of course, that's a given. Like, you have to be sure of what you're saying, you have to be sure of the diagnosis you're giving your patient in real life. So, of course, they would expect you to be sure of your answers for your exams as well. That's one thing I just wanted to touch on. So I guess we're talking a lot about preparing yourself for the exams, studying and whatnot. I also feel like a very important part of a very important part of this process is also your mindset.
Yep. Yeah.
Because you can get very, very frustrated easily because it's just so stressful. So how are you able to prepare yourself, like mentally, like your mindset? How are you able to just get through everything, shelve all distractions, and then you just reach your goal? How are you able to prepare for that?
I love these questions. I love that. Okay, the answer is sheer fear. The fear of failing was just my only. I'm just kidding. I was not the nicest person to be around during the exams, for sure. It was just all the stress, right? All the stress gets to you, for sure. Okay, so AFK. So here's the thing. I'll just say this. I think this goes for anything in life. Honestly, that's like my philosophy in life, is that you have to have plans, and you have to have plans on top of plans, and you have backup plans for your backup plans. Like, you have to plan everything. So I literally had plans of like, okay, if I pass AFK, this. If I don't pass AFK, this. And all the way down, right? So I had plans. And then the mentality, honestly, for me, failing was not an option. It really wasn't, like, financially anyway. I just couldn't fail. So my whole mind and my body was in just like survival mode of like, we need to pass this, right? But I'll say this. I think what's really, I used to meditate during ACS.
Nice.
Yeah, that helps. But also, I think what's really, really important, I think a lot of you have had experiences like that, but when you visualize things, right? When you're going for something, or when you're going for the exam, or when you're going, even if when you wake up in the morning, right? And you just close your eyes and you imagine like the outcome that you're hoping for. And then somehow it just magically happens, right? Doing that is really important. But honestly, at the end of the day, I feel like it's hard work, but what you're saying, mentality, let me tell you this. When we were instructing ACS, towards the end of the course, when people were signing up for the exam, but right before that, all the instructors would get together and we would say, because we're supposed to tell people like, you're ready, you're not ready, right? And we would just be like, what about this person? What about that person? One thing that we would look at was if they fit.
Sorry, Dr. Fatemeh, sorry to interrupt you. So I can see a timer counting down.
No.
In case if we get disconnected, we're gonna come back on because I wanted us to do the Q&A question. So just be aware of that, everybody. Like, if this happens, we're definitely gonna come back on. Okay. All right, so you can go ahead. Sorry about that.
So no worries. So one thing that we would look at was the person's just how they are, like they're actually like their emotional approach. We would have students in class that their work was really good, right?
Mm-hmm.
Their skills were good. But
Okay.
every time you sat with a student, they would be like, I don't think I can do it. I don't think I'm going to pass. If you don't think you're going to pass, you're not going to pass. It's as simple as that. How much time do I have? Because I want to get into
All
like
right, you know what? Let's end it now,
Okay.
and then we'll just come back to it.
Okay.
Okay, so everybody,
Okay.
we're gonna come back on